Welcome to this Nclex Psychiatric Pharmacology Mastery session. Today, we're tackling 50 of the most frequently missed questions on lithium and MAOI restrictions, including toxicity, drug interactions, dietary restrictions, serotonin syndrome, hypertensive crisis, and critical patient safety decisions. These questions are designed to test clinical judgment, not simple memorization. Read each scenario carefully, identify the priority concern, and think like the nurse at the bedside. Let's begin. Question 1. A client with bipolar I disorder has been taking lithium carbonate for 3 weeks. During a follow-up visit, the client reports that the prescribed dose has been taken consistently. The nurse notes that the client has developed persistent nausea, increasing thirst, frequent urination, and a new coarse hand tremor. The client states, "I thought the shaking was just because I haven't been sleeping well." Laboratory results show a serum lithium concentration of 1.8 milliequivalent/L. Which action should the nurse take first? A. Administer the next scheduled dose with food to reduce gastrointestinal irritation. B. Hold the lithium dose and notify the prescribing provider about the findings. C. Encourage the client to increase sodium restriction to decrease lithium retention. D. Reassure the client that mild tremors commonly occur during therapeutic lithium treatment. Answer. B. Hold the lithium dose and notify the prescribing provider about the findings. Rationale. A lithium level of 1.8 milliequivalent/L, combined with coarse tremor, gastrointestinal symptoms, polydipsia, and polyuria, is concerning for lithium toxicity. The nurse should hold the medication and promptly notify the provider. Lithium toxicity can progress to severe neurologic manifestations, including ataxia, confusion, seizures, and potentially life-threatening complications. Question 2. A client taking lithium for bipolar disorder develops acute gastroenteritis with repeated vomiting and watery diarrhea. The client calls the psychiatric clinic and states, "I am still taking my lithium because I don't want my mood symptoms to come back." Which instruction by the nurse is the most appropriate? A. Continue taking lithium, but take each dose with an antacid. B. Double your next dose if you vomit shortly after taking it. C. Contact your provider promptly because dehydration can increase lithium toxicity. D. Restrict your fluid intake temporarily to decrease the frequency of diarrhea. Answer. C. Contact your provider promptly because dehydration can increase lithium toxicity. Rationale. Significant vomiting and diarrhea can cause dehydration and sodium depletion, reducing renal clearance of lithium and increasing serum lithium concentrations. Clients taking lithium should maintain adequate fluid and sodium intake and promptly report significant fluid losses. Question 3. A client with bipolar disorder is newly prescribed lithium. During medication teaching, the client says, "I've decided to start a very low sodium diet because I want to improve my blood pressure and lose weight." Which response by the nurse is best? A. That is appropriate because reducing sodium will improve lithium effectiveness. B. You should maintain a consistent sodium intake because major changes can affect lithium levels. C. You should eliminate sodium completely once your lithium level reaches the therapeutic range. D. A low sodium diet is recommended, but you should compensate by drinking less water. Answer. B. You should maintain a consistent sodium intake because major changes can affect lithium levels. Rationale. Lithium and sodium are handled similarly by the kidneys. Sodium depletion can increase lithium reabsorption and raise serum lithium concentrations, increasing toxicity risk. Clients should maintain a relatively consistent sodium intake and adequate hydration. Question 4. A client taking lithium reports that the medication has controlled manic episodes effectively. The client now wants to begin an intensive endurance training program and plans to exercise outdoors for several hours daily. Which teaching point is most important for the nurse to emphasize? A. Avoid all physical activity while taking lithium. B. Increase caffeine intake before exercise to prevent lithium toxicity. C. Maintain adequate hydration and avoid excessive fluid loss during exercise. D. Restrict water intake during exercise because lithium causes fluid retention. Answer. C. Maintain adequate hydration and avoid excessive fluid loss during exercise. Rationale. Dehydration increases the risk of lithium toxicity. Excessive sweating, especially during prolonged exercise or hot weather, can cause fluid and sodium loss and increase lithium retention. The client should maintain adequate hydration and discuss significant changes in exercise intensity with the healthcare provider. Question 5. A client taking lithium reports new onset, severe diarrhea, blurred vision, worsening hand tremors, and difficulty walking in a straight line. The client is alert but appears unsteady. Which finding should the nurse recognize as the highest priority? A. Diarrhea indicating a common gastrointestinal adverse effect. B. Blurred vision indicating a transient medication effect. C. Difficulty walking suggesting neurologic lithium toxicity. D. Hand tremors suggesting that the therapeutic response is beginning. Answer: C. Difficulty walking suggesting neurologic lithium toxicity. Rationale: ataxia or difficulty coordinating movement is a serious manifestation of lithium toxicity, particularly when accompanied by severe diarrhea, visual disturbances, and worsening tremor. The nurse should treat this as an urgent medication-related problem rather than a routine adverse effect. Question 6. A client taking lithium is prescribed hydrochlorothiazide for newly diagnosed hypertension. Several days later, the client develops increasing nausea, muscle weakness, and coarse tremors. Which explanation best accounts for the client's symptoms? A. Hydrochlorothiazide increases renal lithium retention and can raise lithium levels. B. Hydrochlorothiazide increases hepatic lithium metabolism, producing withdrawal symptoms. C. Lithium decreases the antihypertensive effect of hydrochlorothiazide. D. The two medications have no clinically significant interaction. Answer: A. Hydrochlorothiazide increases renal lithium retention and can raise lithium levels. Rationale: thiazide diuretics can decrease lithium clearance, resulting in increased serum lithium concentrations and toxicity. Clients receiving lithium should be monitored closely whenever medications affecting renal fluid or electrolyte handling are initiated or discontinued. Question 7. A client with bipolar disorder taking lithium is prescribed ibuprofen for chronic knee pain. The client asks whether the medication can be taken regularly. Which response by the nurse is most appropriate? A. NSAIDs can increase lithium concentrations, so you should discuss an alternative with your provider. B. Ibuprofen is preferred because NSAIDs increase lithium elimination. C. You can take unlimited ibuprofen as long as you drink extra water. D. Ibuprofen prevents lithium toxicity by increasing sodium excretion. Answer: A. NSAIDs can increase lithium concentrations, so you should discuss an alternative with your provider. Rationale: many NSAIDs can decrease renal lithium clearance and increase serum lithium concentrations, potentially causing toxicity. A client taking lithium should consult the prescriber before regularly using NSAIDs. Question 8. A client taking lithium tells the nurse, "I stopped taking the medication yesterday because I feel completely normal now. I don't think I need it anymore." The client has no current suicidal or manic symptoms. Which response is most appropriate? A. Stopping lithium abruptly is safe once your mood has stabilized. B. You should restart only when you notice manic symptoms returning. C. Lithium should be stopped only under the direction of your prescriber. D. Take twice your usual dose tomorrow to compensate for the missed dose. Answer: C. Lithium should be stopped only under the direction of your prescriber. Rationale: lithium is commonly used for long-term mood stabilization and should not be discontinued independently. Abrupt discontinuation can increase the risk of recurrence of mood symptoms. The client should follow the prescriber's tapering or discontinuation plan. Question 9. A client with treatment-resistant depression is prescribed phenelzyme, a monoamine oxidase inhibitor, MAOI. During dietary teaching, which meal selection indicates that the client requires further education? A. Grilled chicken, steamed broccoli, and white rice. B. Fresh apple slices, baked potato, and grilled fish. C. Aged cheddar cheese, salami, and red wine. D. Fresh turkey sandwich with lettuce and tomato. Answer: C. Aged cheddar cheese, salami, and red wine. Rationale: aged cheeses, cured/fermented meats, and certain alcoholic beverages can contain significant amounts of tyramine. In clients taking MAOIs, excessive tyramine can cause a dangerous release of catecholamines and lead to hypertensive crisis. Question 10. A client taking tranylcypromine reports a sudden severe headache, palpitations, neck stiffness, nausea, and a blood pressure of 214/118 mm Hg shortly after eating a large serving of aged cheese and cured meat. Which action should the nurse take first? A. Place the client in a quiet room and reassess the blood pressure in 30 minutes. B. Recognize the findings as a potential hypertensive crisis and initiate emergency management. C. Administer the next scheduled dose of tranylcypromine to stabilize the client's mood. D. Encourage the client to drink several glasses of water and remain seated. Answer. B. Recognize the findings as a potential hypertensive crisis and initiate emergency management. Rationale. Severe hypertension accompanied by a sudden severe headache, palpitations, and nausea after tyramine ingestion in a client taking an MAOI is highly concerning for hypertensive crisis. This is an emergency requiring immediate intervention rather than routine reassessment. Question 11. A client taking lithium for bipolar disorder is admitted with a urinary tract infection. The provider prescribes a new medication, and the client tells the nurse, "I usually drink very little water because I don't like having to urinate frequently." Which assessment finding should cause the nurse the greatest concern before the client receives the new medication? A. Serum sodium of 138 milliequivalent/L. B. Serum creatinine of 1.8 milligrams per deciliter. C. Temperature of 38.1 degrees Celsius, 100.6 degrees Fahrenheit. D. Heart rate of 96 per minute. Answer. B. Serum creatinine of 1.8 milligrams per deciliter. Rationale. Lithium is primarily eliminated through the kidneys. An elevated creatinine suggests impaired renal function, which can decrease lithium clearance and increase the risk of accumulation and toxicity. Dehydration from inadequate fluid intake can further increase this risk. Renal function should be evaluated carefully when a client receiving lithium develops an acute illness or begins another medication. Question 12. A client taking lithium has a serum lithium concentration of 0.7 milliequivalent/L and reports mild nausea and a fine hand tremor during the first week of therapy. The client is eating and drinking normally and denies confusion, weakness, ataxia, or severe diarrhea. Which interpretation by the nurse is most appropriate? A. The findings are consistent with severe lithium toxicity and require emergency dialysis. B. The lithium level is within the usual therapeutic range, and mild early adverse effects can occur. C. The client has developed serotonin syndrome and requires immediate administration of an antidote. D. The lithium level is dangerously low, indicating that the dose must be doubled immediately. Answer. B. The lithium level is within the usual therapeutic range, and mild early adverse effects can occur. Rationale. A lithium concentration of 0.7 milliequivalent/L is generally within the commonly used therapeutic range for maintenance treatment. Mild nausea and a fine tremor can occur early in therapy. The nurse should continue monitoring rather than automatically labeling these findings as severe toxicity. Clinical symptoms and trends in lithium levels are important. Question 13. A client taking phenelzyme for depression tells the nurse that a new healthcare provider prescribed dextromethorphan-containing cough syrup for a respiratory infection. Which response is most important? A. Take the cough medication with food to decrease gastrointestinal irritation. B. Take half the prescribed dose because MAOIs increase medication absorption. C. Do not take the medication until the prescriber confirms that it is safe with phenelzyme. D. Take the cough medication only at bedtime because interactions occur mainly during the day. Answer. C. Do not take the medication until the prescriber confirms that it is safe with phenelzyme. Rationale. Dextromethorphan can interact dangerously with MAOIs, increasing the risk of excessive serotonergic activity and potentially serotonin syndrome. Clients taking MAOIs should consult their prescriber or pharmacist before taking OTC cough and cold preparations because many contain interacting ingredients. Question 14. A client taking an MAOI is brought to the emergency department with agitation, diaphoresis, hyperreflexia, muscle rigidity, tremors, and a temperature of 40 degrees Celsius 104 degrees Fahrenheit. The client's medication history reveals that a serotonergic antidepressant was started several days ago. Which complication should the nurse suspect? A. Lithium toxicity. B. Neuroleptic malignant syndrome. C. Serotonin syndrome. D. Anticholinergic toxicity. Answer: C. Serotonin syndrome. Rationale: agitation, diaphoresis, hyperreflexia, tremor, muscle abnormalities, and hyperthermia are characteristic of serotonin syndrome. Combining serotonergic medications with an MAOI can produce a potentially life-threatening increase in serotonin activity. Immediate medical management is required. Question 15. A client who has been taking phenelzyne asks why the medication cannot simply be stopped today and replaced with an SSRI tomorrow. Which explanation by the nurse is best? A. MAOIs permanently destroy serotonin receptors, so another antidepressant can never be used. B. MAOIs remain clinically relevant after discontinuation, so an appropriate washout period is needed before starting many serotonergic antidepressants. C. SSRIs are absorbed poorly if they are taken within 24 hours of an MAOI. D. The two medications compete for the same liver enzyme, causing immediate liver failure. Answer: B. MAOIs remain clinically relevant after discontinuation, so an appropriate washout period is needed before starting many serotonergic antidepressants. Rationale: MAOIs require an appropriate washout period before many serotonergic antidepressants are initiated. Starting serotonergic therapy too soon can produce severe or life-threatening serotonin toxicity. The exact transition plan depends on the medications involved and must be prescribed by the provider. Question 16. A client taking lithium is being evaluated after developing worsening tremors and confusion. The nurse reviews the medication profile and discovers that the client recently began taking a medication for hypertension. Which medication would be most concerning because of its potential to increase lithium concentration? A. Hydrochlorothiazide. B. Amlodipine. C. Metoprolol. D. Hydralazine. Answer: A. Hydrochlorothiazide. Rationale: thiazide diuretics, such as hydrochlorothiazide, can reduce renal lithium clearance and significantly increase serum lithium concentrations. This can precipitate toxicity, particularly when combined with dehydration or other factors that alter renal function. Question 17. A client taking lithium is brought to the emergency department after several days of poor oral intake caused by a gastrointestinal illness. The client is confused, has coarse tremors, slurred speech, and an unsteady gait. Which provider prescription should the nurse question? A. Obtain a serum lithium concentration. B. Obtain serum electrolytes and renal function studies. C. Administer the scheduled lithium dose with a small amount of water. D. Establish for access and prepare for fluid and electrolyte management as prescribed. Answer: C. Administer the scheduled lithium dose with a small amount of water. Rationale: the client has multiple signs of moderate to severe lithium toxicity, including confusion, coarse tremor, dysarthria, and ataxia, with a history of probable dehydration. The scheduled lithium dose should not be administered until the client has been evaluated and toxicity addressed. Serum lithium concentration, renal function, and electrolytes are important components of assessment. Question 18. A client taking an MAOI attends a medication teaching session. Which statement indicates that the client has correctly understood the dietary restrictions? A. I can eat aged cheese as long as I drink plenty of water afterward. B. I should avoid foods that are aged, fermented, or cured because they may contain high levels of tyramine. C. I only need to avoid tyramine-containing foods during the first week of treatment. D. Fresh meat is prohibited because all protein-containing foods contain dangerous amounts of tyramine. Answer: B. I should avoid foods that are aged, fermented, or cured because they may contain high levels of tyramine. Rationale: clients taking MAOI should avoid or carefully follow current dietary guidance regarding tyramine-rich aged, fermented, and cured foods. Tyramine can trigger excessive catecholamine release in the presence of MAO inhibition, potentially producing a severe hypertensive reaction. Question 19. A client taking lithium tells the nurse, "My hands shake a little after each dose. but I don't feel sick otherwise. Which additional finding would most strongly suggest that the tremor has progressed from a relatively common adverse effect to possible lithium toxicity? A. Fine tremor that improves after resting. B. Mild thirst with normal urine output. C. Coarse tremor accompanied by ataxia and confusion. D. Mild nausea shortly after taking the medication. Answer: C. Coarse tremor accompanied by ataxia and confusion. Rationale: a fine tremor can occur during lithium therapy, particularly early in treatment. A coarse tremor, especially when accompanied by ataxia, confusion, dysarthria, or gastrointestinal symptoms, is much more concerning for lithium toxicity and requires prompt evaluation. Question 20. A client taking phenelzyme calls the psychiatric clinic reporting a severe pounding headache, chest discomfort, palpitations, and a blood pressure of 198/112 mmHg. The client says, "I ate some fermented food at a party about an hour ago." Which instruction should the nurse provide? A. Take your next phenelzyme dose immediately to prevent your blood pressure from increasing further. B. Lie down and recheck your blood pressure tomorrow morning. C. Drink several glasses of water and eat a high-sodium meal. D. Seek emergency medical care immediately because these findings may indicate an MAOI-associated hypertensive crisis. Answer: D. Seek emergency medical care immediately because these findings may indicate an MAOI-associated hypertensive crisis. Rationale: severe headache, marked hypertension, palpitations, and chest discomfort following consumption of potentially tyramine-containing food while taking an MAOI are classic warning signs of a hypertensive crisis. This is an emergency. The client should receive immediate evaluation rather than attempting to manage the episode at home. Question 21. A client with bipolar I disorder has been taking lithium for several months with good mood stabilization. The client is prescribed lisinopril for newly diagnosed hypertension. 2 weeks later, the client presents for follow-up reporting increasing thirst, nausea, muscle weakness, and a new coarse tremor. The nurse recognizes that the client may be experiencing lithium accumulation. Which mechanism best explains this concern? A. Lisinopril increases hepatic metabolism of lithium, producing toxic lithium metabolites. B. Lisinopril can reduce renal lithium clearance, increasing the serum lithium concentration. C. Lisinopril increases gastrointestinal absorption of lithium, but has no effect on renal elimination. D. Lisinopril binds lithium in the bloodstream, producing a neurotoxic compound. Answer: B. Lisinopril can reduce renal lithium clearance, increasing the serum lithium concentration. Rationale: ACE inhibitors such as lisinopril can increase lithium concentrations, partly through effects on renal sodium and fluid handling. Lithium has a narrow therapeutic index, so even medications that alter its renal clearance can precipitate toxicity. New tremor, gastrointestinal symptoms, weakness, or neurologic changes warrant prompt assessment of the lithium level and renal function. Question 22. A client taking lithium has been stable for several months. During a routine visit, the client reports that a new job requires working outdoors in extreme heat for 8 to 10 hours each day. The client says, "I sweat heavily, but I usually avoid drinking much water because I don't want to keep stopping to use the bathroom." Which teaching should the nurse prioritize? A. Your body will adapt to the heat, so your lithium dose should not be affected. B. Limit sodium intake while working outside because sodium increases lithium absorption. C. Significant sweating and inadequate fluid replacement can increase lithium levels and toxicity risk. D. Take an additional lithium dose after work to replace the medication lost through sweating. Answer: C. Significant sweating and inadequate fluid replacement can increase lithium levels and toxicity risk. Rationale: lithium levels can rise when the client experiences dehydration or significant sodium loss. Prolonged heat exposure and heavy sweating increase this risk. Maintaining adequate fluid and consistent sodium intake is an important component of lithium safety. Question 23. A client taking lithium arrives at the clinic after accidentally taking twice the prescribed dose. The client currently has no symptoms and states, "I feel fine, so I don't think anything needs to be done." Which response by the nurse is most appropriate? A. Because you are asymptomatic, Simply skip tomorrow's dose. B. Lithium toxicity can develop even before severe symptoms appear, so you need prompt evaluation. C. Drink a large amount of water and exercise to eliminate the excess lithium. D. Take your regular dose tonight to keep the serum level stable. Answer: B. Lithium toxicity can develop even before severe symptoms appear, so you need prompt evaluation. Rationale: lithium has a narrow therapeutic index, and an excessive dose can result in toxicity. Absence of symptoms does not rule out a clinically significant elevation. The client requires prompt assessment, including medication history, serum lithium concentration when appropriate, renal function, and electrolytes. Question 24. A client taking lithium asks the nurse whether pregnancy can occur safely while receiving the medication. Which response is most appropriate? A. Lithium has no fetal effects, so pregnancy requires no medication discussion. B. You should stop lithium immediately if pregnancy occurs, without contacting your provider. C. Discuss pregnancy planning with your prescriber because lithium requires individualized risk-benefit assessment during pregnancy. D. Lithium permanently prevents pregnancy while you are taking it. Answer: C. Discuss pregnancy planning with your prescriber because lithium requires individualized risk-benefit assessment during pregnancy. Rationale: lithium can be used in pregnancy in selected circumstances, but it requires careful individualized risk-benefit assessment and monitoring. Clients should not abruptly discontinue treatment without medical guidance because relapse of bipolar disorder can also pose significant risks. Question 25. A client taking lithium is scheduled for laboratory monitoring. Which combination of assessments is most important for ongoing lithium safety? A. Serum lithium concentration, renal function, electrolytes, and thyroid function. B. Hemoglobin, platelet count, INR, and serum amylase. C. Troponin, CKMB, BNP, and arterial blood gases. D. Bilirubin, alkaline phosphatase, albumin, and ammonia. Answer: A. Serum lithium concentration, renal function, electrolytes, and thyroid function. Rationale: lithium therapy requires monitoring of serum lithium concentrations, renal function, electrolytes, and thyroid function. Lithium is renally eliminated and can affect thyroid function. Monitoring helps identify toxicity and longer-term adverse effects before they become severe. Question 26. A client taking phenelzyme reports that an urgent care provider recommended an OTC decongestant for nasal congestion. Which ingredient should make the nurse particularly concerned about a potentially dangerous interaction with the MAOI? A. Pseudoephedrine. B. Guaifenesin. C. Saline nasal spray. D. Acetaminophen. Answer: A. Pseudoephedrine. Rationale: sympathomimetic decongestants such as pseudoephedrine can interact with MAOIs and cause excessive adrenergic effects, including severe hypertension. Clients taking MAOIs should consult a healthcare professional before using OTC cold or allergy preparations. Question 27. A client taking an MAOI develops a sudden severe headache and blood pressure of 210/120 mmHg after unknowingly consuming a tyramine-rich food. Which physiologic process is primarily responsible for this reaction? A. Excessive acetylcholine release causing profound parasympathetic stimulation. B. Increased catecholamine activity caused by impaired metabolism of tyramine-derived sympathomimetic effects. C. Increased insulin secretion causing acute hypoglycemia. D. Increased serotonin breakdown causing cerebral vasodilation. Answer: B. Increased catecholamine activity caused by impaired metabolism of tyramine-derived sympathomimetic effects. Rationale: MAO normally helps metabolize tyramine. When MAO is inhibited, tyramine can contribute to excessive catecholamine release, producing marked vasoconstriction, tachycardia, and severe hypertension. This reaction can become a medical emergency. Question 28. A client taking lithium reports increased urination and thirst. The nurse notes that the client has a serum sodium level of 132 milliequivalent/L and a serum lithium concentration above the prescribed therapeutic range. Which interpretation is most appropriate? A. Hyponatremia can contribute to increased lithium retention and toxicity. B. Hyponatremia protects against lithium toxicity by increasing renal lithium excretion. C. The findings indicate that the client needs a higher lithium dose. D. Increased thirst and urination prove that lithium therapy is ineffective. Answer. A. Hyponatremia can contribute to increased lithium retention and toxicity. Rationale: sodium depletion can increase renal reabsorption of lithium, raising serum lithium concentrations. A client receiving lithium should avoid major fluctuations in sodium intake and should be assessed promptly when significant fluid or electrolyte disturbances occur. Question 29. A client taking phenelzyne tells the nurse, "I have a headache, but I don't want to bother anyone. I'll just take an OTC cold medicine that contains pseudoephedrine." Which nursing response is best? A. That is safe as long as you take it with food. B. Take twice the usual dose because MAOIs reduce decongestant absorption. C. Do not take it without checking with your prescriber or pharmacist because some decongestants can cause dangerous hypertension with MAOIs. D. Pseudoephedrine is safe with MAOIs as long as your blood pressure is normally low. Answer. C. Do not take it without checking with your prescriber or pharmacist because some decongestants can cause dangerous hypertension with MAOIs. Rationale: OTC products can contain sympathomimetic agents that may produce dangerous cardiovascular effects when combined with MAOIs. Clients taking MAOIs should have all OTC medications reviewed before use. Question 30. The nurse is caring for 4 clients receiving psychiatric medications. Which client should the nurse assess first? A. A client taking lithium who reports mild nausea after breakfast and has a lithium level of 0.8 milliequivalent/L. B. A client taking phenelzyne who reports mild dry mouth but has stable vital signs. C. A client taking lithium who reports increased thirst and a fine tremor but is alert and ambulatory. D. A client taking phenelzyne who suddenly develops a severe headache, chest pain, and blood pressure of 220/124 mmHg. Answer. D. A client taking phenelzyne who suddenly develops a severe headache, chest pain, and blood pressure of 220/124 mmHg. Rationale: this client has findings highly concerning for an MAOI-associated hypertensive crisis, which can result in stroke, myocardial ischemia, seizures, or other life-threatening complications. This takes priority over mild expected adverse effects or less severe lithium-related findings. Question 31. A client with bipolar disorder has been taking lithium for 6 months. The client recently started a strict ketogenic diet and reports that food intake has decreased substantially. At today's appointment, the client has nausea, worsening tremors, lethargy, and difficulty maintaining balance. The serum lithium concentration is 1.9 milliequivalent/L. Which intervention should the nurse anticipate? A. Administer the scheduled lithium dose with a carbohydrate-rich meal. B. Hold lithium and prepare for urgent evaluation and treatment of toxicity. C. Encourage the client to continue the ketogenic diet while increasing the lithium dose. D. Reassure the client that the symptoms represent the expected therapeutic effect. Answer. B. Hold lithium and prepare for urgent evaluation and treatment of toxicity. Rationale: a lithium concentration of 1.9 milliequivalent/L accompanied by worsening tremor, lethargy, nausea, and ataxia is strongly concerning for lithium toxicity. The nurse should withhold lithium and promptly notify the provider. Changes in fluid, sodium, and nutritional intake can increase toxicity risk. Question 32. A client with bipolar I disorder has been taking lithium consistently for the past 8 months with stable mood control. During a primary care visit, the provider prescribes hydrochlorothiazide for newly diagnosed hypertension. Before the first dose is administered, the nurse reviews the client's medications and laboratory results. The client's most recent lithium concentration is 0.8 milliequivalent/L. Serum creatinine is within the client's baseline range, and the client reports no symptoms of lithium toxicity. Which nursing action is most appropriate? A. Administer hydrochlorothiazide as prescribed because the client's current lithium concentration is therapeutic. B. Question the prescription because hydrochlorothiazide can decrease renal lithium clearance and increase the risk of lithium toxicity. C. Administer hydrochlorothiazide but instruct the client to eliminate dietary sodium to improve its antihypertensive effect. D. Hold lithium permanently because thiazide diuretics are absolutely contraindicated in clients receiving lithium. Answer. B. Question the prescription because hydrochlorothiazide can decrease renal lithium clearance and increase the risk of lithium toxicity. Rationale: thiazide diuretics can reduce renal lithium clearance, causing serum lithium concentrations to rise and potentially producing toxicity. A therapeutic lithium level before starting hydrochlorothiazide does not eliminate this interaction risk. The nurse should recognize the interaction, notify the prescriber, and anticipate appropriate lithium level, renal function, and clinical monitoring and/or lithium dose adjustment. The combination is not necessarily an absolute contraindication, making D2 absolute. Sodium restriction should not be initiated independently because maintaining a consistent sodium intake is important during lithium therapy. Question 33. A client taking lithium tells the nurse, "I have been drinking much more water than usual because I'm constantly thirsty." The client reports urinating every hour throughout the day and night. Which complication should the nurse consider? A. Nephrogenic diabetes insipidus related to lithium therapy. B. Acute hepatic failure caused by lithium accumulation. C. Syndrome of inappropriate antidiuretic hormone secretion. D. Acute urinary retention caused by lithium-induced bladder dysfunction. Answer. A. Nephrogenic diabetes insipidus related to lithium therapy. Rationale: long-term lithium therapy can impair the kidney's response to antidiuretic hormone, producing nephrogenic diabetes insipidus. Classic manifestations include polyuria and polydipsia. Persistent symptoms require evaluation of renal function, electrolytes, hydration status, and the continued appropriateness of lithium therapy. Question 34. A client taking lithium has been instructed to maintain adequate fluid intake. Which statement by the client demonstrates the best understanding of the teaching? A. I will drink as little as possible on days when I take lithium. B. I will drink excessive amounts of water every day to flush lithium from my body. C. I will maintain a consistent fluid intake and increase attention to hydration during illness or heavy sweating. D. I only need to drink fluids when I develop a hand tremor. Answer. C. I will maintain a consistent fluid intake and increase attention to hydration during illness or heavy sweating. Rationale: the goal is consistent adequate hydration, not fluid restriction or excessive forced water intake. Vomiting, diarrhea, fever, heavy sweating, and other causes of fluid loss can increase lithium toxicity risk. Question 35. A client taking tranylcypromine asks whether a glass of wine with dinner is acceptable. Which response by the nurse is most appropriate? A. Alcohol is always safe with MAOIs as long as the amount is small. B. You should discuss alcohol use with your prescriber because certain alcoholic beverages and individual reactions can create significant risks during MAOI therapy. C. Wine is recommended because it prevents tyramine from entering the bloodstream. D. Alcohol completely neutralizes the effects of tyramine-containing foods. Answer. B. You should discuss alcohol use with your prescriber because certain alcoholic beverages and individual reactions can create significant risks during MAOI therapy. Rationale: MAOI dietary counseling includes caution regarding certain alcoholic beverages, particularly those that may contain tyramine. Alcohol can also worsen CNS effects and impair judgment about dietary restrictions. The safest approach is individualized guidance from the prescriber or pharmacist. Question 36. A client taking phenylzyme develops agitation, diaphoresis, tremor, diarrhea, hyperreflexia, and a temperature of 39.5 degrees Celsius (103.1 degrees Fahrenheit) after taking an unreported serotonergic medication. Which additional finding would most strongly support serotonin syndrome rather than an MAOI-induced hypertensive crisis alone? A. Blood pressure of 190/110 mmHg. B. Severe occipital headache. C. Hyperreflexia with inducible or spontaneous clonus. D. Palpitations. Answer. C. Hyperreflexia with inducible or spontaneous clonus. Rationale: clonus and hyperreflexia, particularly when accompanied by agitation, diaphoresis, tremor, diarrhea, and hyperthermia are highly characteristic of serotonin toxicity. Severe hypertension can occur in serotonin syndrome, so blood pressure elevation alone does not distinguish the conditions. Question 37. A client taking lithium presents with vomiting, coarse tremors, confusion, and an unsteady gait. The provider orders a serum lithium concentration, basic metabolic panel, and renal function studies. The client asks, "Why do you need to check my kidneys?" Which explanation is most accurate? A. The kidneys convert lithium into its active form. B. Lithium is primarily eliminated through the kidneys, so impaired renal function can cause it to accumulate. C. Lithium damages the liver first, and the kidneys are checked only to confirm liver failure. D. Renal testing determines whether lithium has been absorbed through your stomach. Answer: B. Lithium is primarily eliminated through the kidneys, so impaired renal function can cause it to accumulate. Rationale: lithium is primarily cleared by the kidneys. Reduced renal function can therefore cause lithium accumulation and toxicity. This is why renal function is an essential component of ongoing lithium monitoring. Question 38. A client who takes phenelzyme for depression develops a severe headache and marked hypertension after eating a large quantity of aged cheese. Which provider prescription should the nurse question? A. Continuous blood pressure monitoring. B. Immediate cardiovascular and neurologic assessment. C. Administration of an appropriate antihypertensive medication as prescribed. D. Administration of the client's next scheduled dose of phenelzyme. Answer: D. Administration of the client's next scheduled dose of phenelzyme. Rationale: the presentation is consistent with a potentially serious MAOI-associated hypertensive reaction. The client requires immediate assessment and treatment. The nurse should not independently administer another dose of the suspected interacting medication during an acute adverse reaction without appropriate provider direction. Question 39. A client taking lithium reports that a primary care provider prescribed naproxen for chronic back pain. The client has not yet started the medication. Which nursing action is most appropriate? A. Tell the client to begin naproxen and increase the lithium dose if mood symptoms worsen. B. Explain that NSAIDs can increase lithium levels and instruct the client to discuss the medication with the prescriber before starting it. C. Tell the client that only aspirin interacts with lithium, so naproxen is safe. D. Instruct the client to stop lithium permanently while taking naproxen. Answer: B. Explain that NSAIDs can increase lithium levels and instruct the client to discuss the medication with the prescriber before starting it. Rationale: NSAIDs can decrease renal lithium clearance, potentially increasing serum lithium concentrations. Not every NSAID produces the same degree of interaction, but routine NSAID use in a client taking lithium should be reviewed by the prescriber, with monitoring when appropriate. Question 40. The nurse receives change of shift reports on 4 psychiatric clients. Which client should be assessed first? A. A client taking lithium with mild thirst and a lithium concentration of 0.9 milliequivalent/L. B. A client taking phenelzyme who reports mild constipation but has stable vital signs. C. A client taking lithium who has new coarse tremors, vomiting, confusion, and an unsteady gait. D. A client taking phenelzyme who asks whether fresh vegetables are permitted on the diet. Answer: C. A client taking lithium who has new coarse tremors, vomiting, confusion, and an unsteady gait. Rationale: the combination of coarse tremor, vomiting, confusion, and ataxia strongly suggests clinically significant lithium toxicity. This client has an immediate safety concern and requires prompt assessment, medication withholding as appropriate, serum lithium measurement, renal/electrolyte evaluation, and provider notification. Question 41. A client with major depressive disorder has been taking phenelzyme for several months. During medication reconciliation, the nurse discovers that the client has been taking an OTC herbal preparation containing St. John's wort because a friend recommended it. The client currently reports agitation, sweating, tremors, and intermittent diarrhea. Which action should the nurse take first? A. Tell the client to increase the dose of St. John's wort because the antidepressant effect is inadequate. B. Recognize the potential for a serious serotonergic interaction and notify the provider promptly. C. Instruct the client to take St. John's wort only every other day. D. Reassure the client that herbal medications cannot interact with prescription antidepressants. Answer. B. Recognize the potential for a serious serotonergic interaction and notify the provider promptly. Rationale. St. John's wort has serotonergic activity and should not be combined with an MAOI because of the risk of serious serotonin toxicity. Agitation, diaphoresis, tremor, and diarrhea are concerning manifestations. The nurse should promptly escalate the concern rather than treating the herbal preparation as harmless. Question 42. A client taking phenelzyne is admitted for surgery. During the preoperative medication reconciliation, the client says, "I didn't mention my antidepressant because I've been taking it for years." Which nursing action is most important? A. Document the medication but allow the surgical team to decide whether it matters. B. Ensure the surgical and anesthesia teams are immediately aware that the client is taking an MAOI. C. Tell the client to take an additional dose before surgery to prevent postoperative depression. D. Tell the client that MAOIs have no relevance to anesthesia once therapy has been established. Answer. B. Ensure the surgical and anesthesia teams are immediately aware that the client is taking an MAOI. Rationale. MAOIs can interact with numerous medications used during anesthesia and perioperative care, including certain sympathomimetic and serotonergic agents. Complete medication reconciliation is essential so the anesthesia and surgical teams can select appropriate medications and monitoring strategies. Question 43. A client who has been taking phenelzyne asks when it would be safe to begin another antidepressant after discontinuing the MAOI. Which response is most accurate? A. You can start any antidepressant immediately after your last MAOI dose. B. A washout period is generally required before starting many antidepressants, and the exact interval depends on the medications involved. C. You only need to wait until you no longer feel depressed. D. The washout period is unnecessary if the antidepressant is taken at bedtime. Answer. B. A washout period is generally required before starting many antidepressants, and the exact interval depends on the medications involved. Rationale. MAOIs can have clinically important effects after discontinuation. Appropriate washout periods are required before many antidepressants are initiated to reduce the risk of serotonin syndrome and other serious interactions. The exact transition depends on the specific medications. Question 44. A client taking lithium presents with severe vomiting and diarrhea after eating contaminated food. The client is weak and confused. Which laboratory result would provide the nurse with the greatest additional concern for worsening lithium toxicity? A. Sodium 128 milliequivalent/L. B. Hemoglobin 14.2 g/dl. C. Calcium 9.4 milligrams per deciliter. D. Platelets 250,000/mm superscript 3. Answer. A. Sodium 128 milliequivalent/L. Rationale. Hyponatremia combined with volume depletion can increase renal reabsorption of lithium and contribute to elevated serum lithium concentrations. The client's vomiting and diarrhea already create a significant dehydration risk, making the low sodium particularly concerning. Question 45. The nurse is providing discharge teaching to a client newly prescribed lithium. Which statements by the client demonstrate appropriate understanding? Select all that apply. A. I should keep my fluid intake reasonably consistent from day to day. B. I should report severe vomiting or diarrhea to my healthcare provider. C. I can make major changes to my salt intake without telling anyone. D. I should ask before regularly taking NSAIDs such as ibuprofen. E. A coarse tremor with confusion can be a warning sign of toxicity. F. Once my mood improves, I can stop lithium abruptly. Answer. A, B, D, E. Rationale. Lithium safety depends heavily on stable hydration and sodium balance. Significant vomiting or diarrhea can increase toxicity risk. NSAIDs may reduce lithium clearance, and coarse tremor with neurologic changes can indicate toxicity. The client should not abruptly discontinue lithium or make major dietary changes without medical guidance. Question 46. A client taking an MAOI accidentally consumes a large amount of aged cheese and develops a sudden severe headache, neck stiffness, palpitations, and blood pressure of 216/120 mm Hg. The client is alert but extremely anxious. Which nursing action is the priority? A. Encourage the client to ambulate to decrease anxiety. B. Place the client on immediate monitoring and initiate emergency management for suspected hypertensive crisis. C. Give the next scheduled dose of the MAOI. D. Offer a high-carbohydrate snack and reassess the blood pressure in 1 hour. Answer. B. Place the client on immediate monitoring and initiate emergency management for suspected hypertensive crisis. Rationale. This presentation strongly suggests an MAOI-associated hypertensive crisis. Severe hypertension with acute headache and cardiovascular symptoms can result in stroke, myocardial ischemia, seizures, or other life-threatening complications. Immediate assessment and emergency treatment take priority. Question 47. A client taking lithium arrives at the emergency department with a serum lithium concentration of 2.3 milliequivalent/L. The client is confused, severely ataxic, and has persistent vomiting. Which intervention should the nurse anticipate as part of the management of severe lithium toxicity? A. Administration of additional lithium to stabilize the serum concentration. B. Preparation for aggressive supportive management and possible extracorporeal removal depending on the clinical situation. C. Administration of a tyramine-containing meal. D. Restriction of all fluids to prevent further lithium distribution. Answer. B. Preparation for aggressive supportive management and possible extracorporeal removal depending on the clinical situation. Rationale. A markedly elevated lithium concentration accompanied by serious neurologic and gastrointestinal manifestations represents severe toxicity. Management includes stopping lithium, correcting fluid/electrolyte abnormalities, monitoring renal function and lithium concentrations, and considering hemodialysis or another extracorporeal treatment when clinically indicated. Question 48. The nurse is evaluating a client taking phenelzyme who has developed agitation, diaphoresis, tremor, hyperreflexia, and a temperature of 40 degrees Celsius 104 degrees Fahrenheit. The client recently received another serotonergic medication. Which additional finding would most strongly support serotonin syndrome? A. Lead pipe muscle rigidity with markedly elevated creatine kinase after antipsychotic exposure. B. Inducible clonus and rapidly worsening neuromuscular activity. C. Severe hypertension immediately after eating aged cheese. D. Isolated dry mouth without neurologic changes. Answer. B. Inducible clonus and rapidly worsening neuromuscular activity. Rationale. Clonus, hyperreflexia, tremor, agitation, diaphoresis, and hyperthermia strongly support serotonin syndrome. Neuroleptic malignant syndrome is more commonly characterized by severe generalized rigidity and elevated CK, while an MAOI-related hypertensive crisis is particularly associated with severe hypertension following tyramine or sympathomimetic exposure. Question 49. A client taking lithium tells the nurse, "I have been feeling much better, so I stopped taking it 2 days ago. I also started a very low-sodium diet and have been exercising outdoors for several hours every day." Which response by the nurse is most appropriate? A. Those changes are appropriate because lithium should be discontinued once mood symptoms improve. B. The combination of stopping lithium, changing sodium intake, and intense exercise requires discussion with your prescriber because it can destabilize treatment and alter fluid and electrolyte balance. C. The only concern is exercise. Your sodium restriction has no effect on lithium. D. Restart lithium at twice your previous dose to compensate for the missed doses. Answer. B. The combination of stopping lithium, changing sodium intake, and intense exercise requires discussion with your prescriber because it can destabilize treatment and alter fluid and electrolyte balance. Rationale. The client has made multiple potentially dangerous treatment changes independently. Abruptly stopping lithium can increase the risk of recurrence of mood symptoms, while major sodium restriction and heavy exercise with fluid loss can affect lithium pharmacokinetics if therapy is restarted. The client needs individualized medical guidance rather than self-adjustment of the medication. Question 50. The nurse is conducting final discharge teaching for 4 clients receiving psychiatric medications. Which client statement requires the nurse to intervene immediately? A. I'm taking lithium, so I'll try to keep my fluid and salt intake consistent. B. I'm taking phenelzyme, so I'll check with my pharmacist before using OTC cold medicine. C. I'm taking lithium, and if I develop severe diarrhea, I'll contact my healthcare provider. D. I'm taking phenelzyme, but if I accidentally eat aged cheese and develop a severe headache, I'll just take my next dose and wait for it to go away. Answer: D. I'm taking phenelzyme, but if I accidentally eat aged cheese and develop a severe headache, I'll just take my next dose and wait for it to go away. Rationale: a severe headache after consuming a potentially tyramine-rich food while taking an MAOI may signal a hypertensive crisis and requires urgent medical evaluation. Taking another MAOI dose and waiting at home could delay treatment of a potentially life-threatening complication. That's the end of our 50-question psychiatric pharmacology challenge. If you missed some questions, don't just memorize the answers. Review why the incorrect options were unsafe. Remember, with lithium, think fluid, sodium, renal function, and toxicity. With MAOIs, think tyramine, drug interactions, hypertensive crisis, and serotonin syndrome. Keep practicing, keep reviewing your weak areas, and most importantly, keep thinking like an Nclex nurse.